Hello.
Hey, nurse. Oh, it was so smooth. You connected right
Yeah,
away. So I'm glad. Yeah, how's
we
it
got.
going?
I'm hearing an echo. Are you
Oh,
hearing
you
an
are?
echo?
You know what? I'm not. Let me
Okay.
see.
Maybe I should try to go out and come back in. Or it went away.
Okay, there. Okay, perfect. Yeah, it might be like a connection thing, but I'm glad that.
Yeah. Good.
Okay,
Perfect.
perfect. Yeah. So I'll go ahead and start. You know what? We got 16. That's awesome.
Yeah.
Okay. Yeah. So all right, let's start this thing. I'm gonna introduce you, okay?
Okay.
So Nurse Rosa, she has an array of experience from working in the Neuro ICU to bedside nurse, just to name a few. She created the award-winning podcast Stronger After Stroke for the Norton Neuroscience Institute. So she aims to elevate the quality of life for nurses as well as patients. So we'll go ahead and welcome Nurse Rosa. And I did want to read a little thing about nurses. So it says, according to medical experts, nurses play a crucial role in stroke recovery. I know they did for mine. And ultimately aiming to maximize the patient's independence and quality of life post-stroke. So yeah, let's welcome Nurse Rosa. Give her some hearts,
Oh,
guys. Hi.
thanks. I see those hearts. Thank you.
Yeah, you're welcome. Hi.
Yeah, I really
Yeah.
appreciate you inviting me to come on and talk to you today. I love talking to stroke survivors, and it's even my day off. So,
Yeah, you're so passionate about it. I think that's why I really connected with your content. Yeah,
yeah.
just to say, if you guys aren't following her already, make sure you follow her on Instagram and all the other channels as well, and her podcast. Yeah,
Yeah. It's at Nurse Rosa Speaks.
yeah, perfect. You know, what I could say is I wanted to first ask you, could you share anything with us from a nurse's perspective?
Yes. Definitely. So I think what you and I were talking about before is kind of, what do I see as a nurse from the outside of the stroke survivors' experiences? A lot of the people that I talk to at this point, I've been with thousands of people who have had strokes of all different ages and backgrounds, and something that is not officially addressed enough, I think, is the anxiety and depression that often happens when someone has a stroke. Maybe they had baseline anxiety or depression before, but it is normal for anyone who has a stroke to experience that. And if they were not already being treated for that, then they may not have coping mechanisms or know who to talk to or who to ask about those feelings. And especially if they've been the caregiver, like if they are the parent or the grandparent or the person in the family with all the answers, and now all of a sudden they're experiencing a lot of anxiety about, I'm afraid if I lay down and take a nap, will I wake up again? Or will I have another stroke? Which are real concerns. A lot of that fear is not addressed because they don't know how to communicate or who to talk to. And so I really want to just let everybody know that you're not the only one experiencing that. There are people you can talk to about it, whether professionals or other stroke survivors, because another barrier that I've encountered with people of all ages is um, a lot of stroke survivors do not seek out going to official support groups because they're what they verbalized to me over and over is they don't want to go to a support group full of people in like wheelchairs who have like really physical impairments that are visible, and then say, oh, I'm struggling with my fear or my depression when this person can't use their arm or their leg right now. And they kind of feel kind of almost a survivor's guilt is what it sounds like, because their symptoms are not as visible, but those people need support too. And so I really want to encourage all stroke survivors that those needs are valid, and um, it's okay to ask for support.
That's so true. Yeah, it is sometimes hard to ask for help. And then also, you're kind of in denial. I know I was, and it took me some time to finally reach out. I think it made a huge difference. So I like how you're mentioning that. Yeah.
Did you find it helpful to talk to like a professional counselor, or you mean just like with your friends, just being
Oh,
opening up with them,
yeah.
or
So to
what was helpful for
clarify,
you?
for me, I have actually two close friends that were stroke survivors, so we maintained contact a lot. And then I also know a few others that had a stroke, so it helped me in many ways. I think just
Hmm.
having someone relate. And also, we share little things to each other. I think the
Hmm.
other day, one of my friends, he's a stroke survivor. He's like, "Oh, we try our best to kind of live normal and deal with our deficits." And so, when I was looking at him, I never really, thought he was dealing with different things, but he was telling me everything, and I just thought he did a good job. Just I couldn't pay attention or notice. Yeah,
Hmm.
that was who I reached out to. I think.
Yeah.
Yeah.
Yeah. And not all of the ways strokes affect you are visible. Even things like if your balance or your vision is affected, that may not be apparent to the people around you, even though that may dramatically change your life. And so I think open communication is really important, and just creating that safe space for yourself to be open about what you're going through so that you can get help for it. Like talk to people about, yeah, I can't see to do this thing. How can I get help for that? Who can I do some vision rehab with, right?
Yeah.
In order to find the resources to help, we have to be able to talk about it.
Yeah, a stroke of good fortune said mental health and stroke were the hardest things I ever experienced. That's a good one.
Hmm.
Yeah, I had another question as far as being a patient in the hospital. Is there something that you think that patients should know to get the most out of their nurses?
So, when they're in the hospital after having a stroke, I don't know if they will have found your wonderful channel yet. Um, I hope they do quickly. But the purpose of all those medical interactions that is to determine, the cause of the stroke. It can be various different things, and in order to prevent another one from happening, we have to identify the cause. And once we identify the cause, do whatever we can as far as adjusting those modifiable risk factors like blood pressure, blood sugar, cholesterol, if you're overweight, or if you have AFib, or sleep apnea is a really big one. Doing anything you can to prevent it from happening again is really important. So utilizing your nurses and doctors to make sure you get the follow-up you need in order to take those actions is going to be important. I see Nurse Lori right there commenting, knowledge is power, so ask questions. And you know it's not a bad thing to ask questions. It's helpful to write down your questions so that you don't forget. Um, Most people who experience a stroke do have trouble with their memory as well, at least in the beginning.
Oh, okay.
So don't feel bad for forgetting or being on information overload, because this is something new. Usually people don't know much about stroke until they have one, and it's like drinking from a fire hose of all this information about, what just happened to me, why did it happen, what can I do to keep it from happening again. And so like people without a brain injury only retain about 10% of information. So please don't feel bad if your doctor or your nurse is giving you education and you don't remember very much of it. That's normal. That's why it's okay to ask questions. And if you don't have them in person, I would really encourage you to utilize the electronic health record if that's available to you, to send direct messages to your providers in between appointments. I use that with my primary care all the time, because if sometimes you just have a question and you don't need a whole visit about it. You just need to be like, what was it that you said I needed to do about this, and just clarify.
Okay, perfect. Uh, is there something that you wish more people knew about nurses?
um sure. Sorry, this kind of
Uh,
made me think about kind of more of my conversations with other nurses about like our profession and how we want to lead in the community with community education opportunities. um, I think think it's important to realize, like, we do have rules about we're not supposed to interpret like test results and things like that, but we definitely can reinforce anything that's already been explained. So even if the doctors had a conversation with you in your last visit with them, the nurse has the scope of practice to reinforce all of that. So if you're having trouble remembering that and you call the doctor's office and you're like, I don't really understand what they said, they are definitely capable of revisiting those questions and getting you the answers that you need, because people who work in stroke, we answer a lot of these questions every day.
Yeah, I could say I think we were doing that a lot too in the beginning. Because I mean, we didn't see the doctor as much, so we were asking the nurses. So now that makes sense what you're saying. A stroke of good fortune said nurses did more for me than doctors, as they were the most hands-on.
Yeah,
Yeah, nurses are great advocates for patients. Yeah, thank
that's
you.
Nurse Lori there. You need to follow her too. She
Okay.
has a lot of good educational information she puts out about
Oh,
stroke.
that's awesome. Oh, she's in your group
Mhm,
too. So yeah, I'm gonna definitely follow you once we get off this
mhm,
live.
mhm.
Yeah. So what are some tips you could give us on like recovery? Like what things do you feel that is most important, or that you feel that we should know?
So, specifically for people, I'm going to narrow it down because I think this is something that may not always get communicated to people. Sometimes the common knowledge has been around 6 months to a year after a stroke, however you're doing is how you can expect to be, and that's your new normal. But that can be really misleading, and I don't want any stroke survivor to think that that's how they're stuck. The rate of progress does slow down a little bit, but you can continue to improve like 15, 20 years after a stroke. We've seen that too. Neuroplasticity is active, and you do have to activate um, your neurons and tell them how to reconnect, because some have died in the stroke, and the ones that remain need to learn new functions and form new connections. So there are great things like Feldenkrais, which is a somatic therapy class that really accesses uh, this component of our mind where we hold ourselves back. A lot of the times, our own beliefs will hold us back from trying something. If you have a stroke and your right arm isn't working, in my assessment at the bedside, as you all have probably experienced a million times, I would say, hold out both your arms and let's see if you can hold them up off the bed or off the chair. And one of them is weaker, maybe you can't even move it. And I'd have a lot of patients say, um, it's not going to do anything. Well, that's your brain telling it it's not going to do anything. So you have to look at your arm, tell your arm to move, and their physical therapist can really help with things like this, but you have to open your mind to improving, and you may not see an improvement for a while, but it's really important for you to realize that the messages you're telling yourself in your mind, especially the words you say out of your mouth, are sending messages to the parts of you that you're trying to heal. And so you have to be very intentional with your self messaging as you're recovering. And that is the biggest limiting factor.
Awesome. Yeah, I really like how you're saying what you tell yourself to. It might not seem like it, but it is doing something. You just have to be patient and give it some time. I know I relate to that for sure.
There's a really good book about that too, Lights, Mirrors, Action by Dr. Kenneth Monaghan. He's from Ireland, and it's a great uh, book about using mirror therapy. You may have used that, I don't know, where you do an action with one
Oh,
arm and use the mirror to kind of like tell the other arm what to do. And it kind of helps you overcome some of those mental blocks. So that would be
okay,
a good book
great.
to try.
Yeah, you know what? I really love it. Yeah, I've seen some videos and stuff on mirror therapy, and I can
Hmm.
see what like starts twitching the other side does, the affected side. Yeah, it's
Yeah.
so cool. Yeah, you guys make sure you're following her podcast on YouTube, right? Is it only on YouTube?
You mean Stronger After
Oh,
Stroke?
Stronger After Stroke. Yeah.
Yes, Stronger After Stroke is available on all the audio platforms like Apple Podcasts, Spotify, all that, and in addition to YouTube. If you need a translation into another language, YouTube provides that for quite a few languages, I believe. So that's valuable information. Yeah.
Okay, great. Yeah, make sure you guys are following, okay? And yeah, I really appreciate your time, Nurse Rosa, today. And,
You're welcome. Thank you for having me.
yeah, you're welcome. Yeah, it was a pleasure speaking with you. Yeah, okay, well, have a good day, huh?
Thank you for having
Thank you.
me. Okay, bye.
Yeah, I'll be sharing this one, okay? Bye.